While I make every effort to broadcast correct information, I'm also still learning. I will double check all my facts, but realize that healthcare is a constantly changing science and art. One doctor or healthcare provider may have a different way of doing things from another. I welcome any comments, suggestions, or correction of errors. I take no money from supplement or device companies. By listening to this podcast or reading this blog, you agree not to use this podcast or blog as medical advice or to treat any medical condition in either yourself or others, including but not limited to patients that you are treating. Consult your healthcare provider for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast or the website. Under no circumstances shall any guests or contributors to the podcast or blog or any employees, associates, or affiliates of the Boss Body podcast be responsible for damages arising from use of the podcast or the blog. This blog or podcast should not be used in any legal capacity whatsoever, including but not limited to establishing the standard of care in a legal sense or as a basis for expert witness testimony. No guarantee is given regarding the accuracy of any statements or opinions made on the podcast or the blog.
What's up, guys? It's Dr. Tim Jackson with another episode of the Boss Body Podcast. Today, we have a very special guest, Dr. John Lieurance. He is a naturopathic physician, a chiropractor, and really on the cutting edge of stem cells, regenerative medicine, and mitochondrial health. Welcome to the show, Dr. John.
Thank you, Tim. I'm so happy to be here.
Absolutely. So tell us a little bit about, I think you went to chiropractic school first. Is that correct?
Yeah, graduated from Parker Chiropractic College in '96, and afterwards got my chiropractic neurology diplomate, and then eventually decided to go back into school to become a naturopath, and really feel like that training has really created a unique perspective on health and healing that I don't think you could really get any other way. You know, really a big focus on neurological health in particular, and not just from the mitochondrial standpoint, because if you look at nerve theory 101, just basic nerve and brain, it's fuel and activation. So like there's a Chinese proverb that says the unused gate gets the rust, right? And so our brain and our nerves, they require to be fired, and when they're not, there's certain genes that express themselves that build proteins that maintain the structure of the cells. So oftentimes we get locked into loops or cycles with our brain function, and it's those new and novel experiences that really create the most change and growth for our brain. And oftentimes when I'm working with people, I'm looking for those pathways that, you know, they're not firing as much as they could be. And you had mentioned you have a big interest in the lymphatic system, which I do as well. And you know, we understand the lymphatic system, whereas it's primarily triggered during deep sleep. So monitoring our sleep and making sure that we're getting adequate deep sleep is something important. And the movement of that lymphatic system, right? So we have like a gutter system in our brain that clears toxins, and the cranial motion, which is called cranial sacral motion, is a very gentle kind of pumping that keeps cerebral spinal fluid flowing around our brain and spinal cord. And not a lot of people are talking about this phenomenon where our craniums are collapsing, you know, and it's mostly from mouth breathing and you know, very soft foods, a lot of refined foods. Weston Price wrote a whole book on it. I've got it right here. It's called On Physical Degeneration.
Yeah.
In this book, he has, you know, he's got pictures of all these aborigines, you know, with their facial structures. And so he was the first to really bring a lot of attention to this, this cranial collapse that we're getting that has a really big impact on our ability to keep our brain healthy, not just from breathing in.
Right.
And I mean, the rabbit hole goes so deep,
Yeah.
Tim. I mean, I wrote a book on it, which is on Amazon. It's called It's All in Your Head.
Okay.
And it's really a book on endonasal cranial therapy. However, I put a lot of information in there on mouth mouth breathing, nasal breathing, and
Have you seen that? 6 foot
no.
tiger, 3 foot cage. So it's
Oh
just
yeah, yeah,
speaking to
yeah.
you. Yeah,
Yeah, I've heard
speaking
of
to
it.
your point about the reduced real estate for the tongue, and a lot of people think it's strictly a structural or orthopedic issue, but we talked about deep sleep. Well, if you have sleep disordered breathing, you're not getting deep sleep. Therefore, the lymphatic system is not going to work. And so, people ask me, well, why don't you just focus on this one thing? I mean, it's so intertwined. I mean, I would be lying if I think you would agree if you said you could just tease out one aspect or two aspects. And so, I have an oral appliance that brings my mandible down and forward, but I know there's a bioanthropological lab in Paris where she studied skulls of people from a few hundred years ago and then up to the present day. And she talks about how maxillary width, you want to be about 40 to 42 millimeters from 3 to 14, but most people are around 35, 36. And so we're not able to fully oxygenate our tissues, which leads to cellular hypoxia and chronic disease. Touch on that a little bit and how the functional cranial release sort of the mechanisms or what we think the mechanisms are.
Yeah, that's really, really rich topic and one that needs to be talked about more, I believe. So I've been utilizing a cranial release that uses endonasal balloons, and it expands and releases, these, and it really comes down to more of a connective tissue.
Right.
There's a wrapping around the brain and spinal cord called the dura mater, and in Latin that actually means tough mother,
Tough
right?
mother. Yeah.
Yeah, it's kind of funny. But that gets bound up and it interferes with the function of the eyes. And in our clinic, we're testing people's eyes with a device that has an infrared that can detect exactly where the eyes are. And there's three primary eye motions that we're looking at. One is um, pursuit. So when the eyes are following a target, and oftentimes we're seeing that people can't stay on that target in certain quadrants in their hemifields, right?
Right.
Or if there's a saccade, which is a fast eye movement from one point to another, and sometimes the saccades aren't accurate. People can't hit these targets. And then there's holding your gaze or gaze fixation. And what we're seeing is just a rich amount of data where people have dysfunction with their eyes in certain areas. And then what I'll do is I'll muscle test them and find out that their whole body shuts down when their eyes are in certain positions. And sometimes you need to stretch extend the head, laterally flex to really get that dura to figure out like where the restrictions are. And then
Right.
that's where I hold people when I do these balloon releases, and then we retest their eyes, and it's just like incredible. And it plays such a vital role in our ability to build maps and grids of where our body is in comparison
Right.
to our environment. So everything from fine motor skills to athletic abilities to even having like proper tone in our neck. I just saw a patient that flew in from up north, and she came in because she has TMJ, because it works really well for TMJ. But then through the exam, I found out she had severe dystonia. And so dys meaning not good, and tone is muscle tone. And so when the eyes aren't functioning properly, it sends a lot of noise into our neck and spinal muscles where they just get tight. And so this is something that I found early on in my career, that if I could fix a lot of these functional eye movements, that the spine just totally relaxes and I can do an adjustment and people hold their adjustment. So there's another component, because I know a lot of people probably that are listening to this are somewhat familiar with a lot of the work that's been done and the books that have been written on nasal breathing and how important that is. One thing that I point out in my book that I think is just one of the most interesting things is that our brain has a oscillation, right? So there's a frequency, right? I mean, we know about like beta and alpha and delta and all these different oscillations and these frequencies that the nerves are kind of like bouncing through are really, really important because they're rhythms and they change whether we're sleeping or we're waking or whether we're excited. We need to focus, we need to relax. And that message is founded through our respiratory rhythm. And that pacing through our respiratory rhythm is through the nose, and it's the higher areas in our nasal passage that have these receptors, and it picks up on respiratory rhythm because our breathing is going to give a lot of data to our brain on how things need to be adapted to what we're up to.
Right.
And when this message isn't getting through, then we have dysfunction in an area that is called the limbic. We have limbic oscillations, which is where we have our emotions can be triggered, right? And so besides limbic oscillations, you have deeper structures with our salient network, where our ability to focus on something,
Right.
then deeper into our autonomic nervous system, and then an area called the blue spot, which I've been writing a lot about. I've been talking in a lot of other platforms about this locus coeruleus and how important it is to take care of it.
Right.
Because it's kind of like command central for norepinephrine. So whenever,
That's what I was going to say. It's very norepinephrine rich, correct?
yes, yeah. And the one thing that I find the most fascinating about the locus coeruleus is the newer research, because there's a connection with the locus coeruleus and the mouth and the nasal through the trigeminal nerve. And the scientists are actually finding that the beta amyloid starts in the locus coeruleus and starts to work its way up to things like the hippocampus and hypothalamus and so forth. And this is where it's a very high probability that a lot of Alzheimer's and degenerative neurologic disease is coming from, which makes a huge argument for this idea that I talk about called taking care of your doorways, right? The nasal, the mouth, and the colon. And we have some products through Mitozen and some protocols that we are getting some great success with, and this effort to take care of the doorways and how important that is for the brain.
Absolutely. Well, thank you so much for that thorough answer. Reminds me of some of the work of one of my mentors, Kendall Stewart, who's an ENT by training, but basically he got into neurosensory and working with neuro immune disorders. And he found that, certain neurotropic viruses would cause alterations in eye patterns and your ability to track and converge, etc. And along with causing microglial inflammation or inflammation. And so I think that's such a huge area. Can you touch on chronic infections and how they may lead to alterations in eye patterns?
Sure. Well, these systems are so fragile, and we see a lot of people with chronic infections neurologically that are probably that's the cause of a lot of the dysfunction. The inflammation caused by both toxins and infections, especially in the brain, which is the most sensitive to low energy status.
Mhm.
So we have mitochondria that occupy our cells that make energy. And when we look at different cell structures, we can count the amount of mitochondria that are in each cell. And we know that that the cells that have a very high amount of mitochondria require a lot more continuous energy, which is the brain and the heart primarily. And inflammation from infections or toxins create a phenomenon called the cell danger response, or a German scientist coined the term the Warburg effect, which is where there's a switch, the way that the cell makes energy, which drops it down almost 90%. So whenever we have inflammation, or we're going to diminish our life force, our ability to convert energy efficiently from glucose and oxygen. So we want to minimize those those situations to have a maximum benefit for brain health.
Absolutely. And so the cell danger response, I first learned about it, I think 4 years ago when Dr. Naviau's research started coming out, or, maybe a few years before that. But what are some ways, because obviously you said, most people think of mitochondria as the batteries of the cell, but they're actually an entire signaling system. And so, if they're not producing optimal amounts of energy, they're sensing danger. What are some ways we can help to mitigate the cell danger response?
Well, I would say the number one strategy that, besides minimizing inflammation, which is really the leak in the boat, right? So we want to fix that leak. And then melatonin, out of all my research, melatonin has been, because it sits in each mitochondria, and it's the primary antioxidant that quenches that. It allows us to accept more inflammation before we go into that cell danger response. So I look at melatonin as being like the ultimate cell resilience molecule.
Right.
And there's something called a hormetic curve. And so hormesis is where a stressor in a certain dosage can be beneficial because it triggers an adaptive
Adaptation.
response. Yeah. But at too much, it's not, we can't adapt to it, right? So we need a certain level of energy and life force in order to adapt. So if our life force and our energy is low, then we're going to be more challenged to adapt to stresses, so we can accept less stress. We get more diseases. And we all have a certain set of genes, and those genes are going to kind of dictate where our weaker areas are going to be, and then how disease is going to specifically express itself in our body. So when we start to look at metabolic medicine, other people maybe talk about root cause medicine, or mitochondrial based medical model. It makes so much sense to me, because you're really talking about a deep appreciation that the body has the ability to heal itself, right? I mean, you had made a comment just a little bit ago about how people want to just focus on, the sleep for lymphatic system, and they're ignoring other cofactors. But life is complex, and often some of our best results are when we combine different things together, like like methylene blue combined with silver and combined with light. These things are synergistic. Or if you're doing a morning routine, grounding yourself, watching the sun come up, doing breath work, having like a something that really brings different factors all into a more powerful protocol.
Absolutely. And so with melatonin, I know there's been a lot of, well, quote unquote, we'll call it controversy. Some people say, oh, it can stunt the growth of children, or it's going to downregulate your own endogenous production. But Dr. Deanna Minnick, I had her on the show, and she wrote that whole paper on melatonin and its important in the mitochondria, or importance in the mitochondria. Can you touch on the concerns that you hear and some of the falsehoods that are getting spread on social media regarding melatonin?
Well, I mean, I would say like the two big influencers out there, Peter Attia and Andrew Huberman. What I find fascinating is that these two individuals are so talented, and they're so smart and well researched, but they are completely ignoring just this massive body of research. And I mentioned, I also wrote a book on melatonin. It's called Melatonin Miracle Molecule, which is also on Amazon. And it's a deep dive into all things melatonin. And one of the things in the front of the book is it's beyond sleep, because I really wanted to bring forth all of the magic that melatonin provides us outside of just sleep. But to your point, so Andrew Huberman, this is what I understand, is he had I guess he took some melatonin and had some nightmares, right? Which, if you look at the research, there's no there's nothing in the research that suggests that melatonin causes nightmares. And in fact, we actually think that it might be some products have some fillers or something in it, and it might be some excipient in some bad
Right.
melatonin products, because it's not something that was pointed out in any of the research that was done with pure melatonin. So I would imagine that he had that experience, and then he's kind of biased a little bit. And so what he talks about, and I saw like on a Joe Rogan interview, Joe asked him, so does melatonin shut down when you take it, shut down your own production? He sidestepped it. He didn't even answer the question, but he just kind of went into a spiel about, which is just a bunch of nonsense, because we don't have a negative feedback loop with melatonin, and there's no toxicity to it. They've done studies where it would be like 100 to 50,000 milligrams for an average adult, and they stopped it just thinking, hey, there's just no toxicity here. So if there's no toxicity to it, it doesn't shut down our own production. Yet we look in the research and we see that it has massive benefits for everything from cancer to cardiovascular disease, degenerative neurologic disease, liver health, gut microbiome, the eyes, the endocrine system, which this is another thing that that Andrew talks a lot about, is that if you take melatonin, that it's going to shut down somehow, it's going to shut down your hormones. And he talks about delaying puberty and how dangerous it might be with children. And again, total nonsense. There's one study that was done on Siberian hamsters, and these hamsters have breeding cycles. And so in the longer days, which is gonna you're gonna store more melatonin because there's more light, right? They go into more of a dormant state, so they naturally slow down some of their sex hormones. And so this fluctuation in their breeding cycle is just unique to certain animals, and humans don't have this at all. And there's been no studies that have shown that this is a factor. In fact, it's quite the opposite. Where we see that melatonin can improve hormones, and it can protect a lot of our glands from oxidative stress. And in fact, it can enhance couples that are having trouble getting pregnant, and there's some benefit there. So let's talk about Peter Attia. So Peter is extremely conservative with his views on melatonin, and his thought pattern is that you wouldn't want to give any more melatonin that wouldn't mimic what your pineal is producing, and what you might find, which is just a tiny bit that's in the blood, and that there may be some danger associated with going above that. And so because his viewpoint is that it's going to be such a minuscule amount of melatonin, that you can't trust any company, because he points out, he points out a study that was based on CBD gummies, right? Out of like all the thousands of different places you can buy melatonin, how many people are taking it with CBD gummies? But anyway, there was some inaccuracies in the exact amount of melatonin. And so he's basically like, it's so dangerous because you can't know exactly. But if you're coming from my perspective, which, I would say I'm somewhat of an expert, I would say the more the better. So that would be a complete non-issue.
And it results in decreasing thymic involution, right? So it helps to reverse the aging of the thymus, correct?
Well, yeah. And so the thymus is very sensitive to stress, particularly like mental, emotional stress. It's been shown to shrink pretty quickly. And then the thymus produces a lot of really amazing peptides, and a lot of immune cells. And so it's just going to be a consequence of a healthier, more robust individual.
Right, absolutely. And so I noticed you had a reel on Instagram. It was with a surfer. I don't remember his or her name, but their vision, the peripheral vision was off. And then you did the functional cranial release, you retested, and they were like blown away. And quite frankly, so was I. I've known, So I'm a doctor of physical therapy by training, but I learned, the C7T1 manipulation, mid thoracic, side posture in school. But I know even doing like, lower cervical, like people headaches would go away because obviously it's going to affect a few segments above and a few segments below. Can you touch on the peripheral vision and, following? I know serotonin plays a role and horizontal tracking and dopamine plays a role in vertical tracking. Can you touch
Mhm.
on that?
Yeah, well, there's a lot there. So, um, when when we're talking about neck fixations, movement creates an afferent. Afferent is going to the brain, efferent's going away from the brain. So our brain requires a lot of information from the body and particularly from the joints. There's a receptor in all of our joints that are called mechanoreceptors, and they're very large diameter nerves, and it's the primary way that our brain stays afferentated, right? So there's a term called deafferentation. And when we become deafferentated, a lot of us have experienced this when we're couch potatoes or we're not doing a lot, right? And how much better we feel when we start doing athletic activities. And that's because we're moving our joints and we're affertating our brain. And so when the primary places that we have the most concentrated of these mechanoreceptors is in the neck.
Okay.
And so that's why fixations in the neck can be so detrimental to the brain, and they should be corrected. Now, with regards to the eyes, it's really interesting. So the horizontal movement of the eyes is going to be more serotonin based, and it's because it's located in the pons is a lot of the nerves that generate those. And the mesencephalon, which is just above that, is going to deal more with our vertical, and those are going to be associated with dopamine. So that's just the way that we're wired.
Absolutely. Yeah. And so I've noticed, and I mean, like you mentioned at the beginning of the podcast, people won't hold their manipulations or mobilizations, and it's a neurological issue more than anything. And I know when I get adjusted, my buddy who's a DC here locally, when he adjusts me, like I could just tell, I'm in tune with my body enough to know that, okay, I just went way into more of a parasympathetic state, and I try to leave his office and go straight to the gym to take advantage of that new range of motion,
Mm-hmm.
especially in the thoracic spine. But going back to the mitochondria, and ways that we can benefit the mitochondria, we discussed methylene blue, we discussed melatonin. What are some other ways that we can boost or enhance mitochondrial function?
Well, there's my top three would be melatonin, methylene blue, and NAD. And
Okay.
they all kind of have a unique, and that, of course, taking care of your doorways. We have an antimicrobial nasal spray called Glutastat that we've had really good success with. A lot of people carry this really difficult to get rid of infection called Marcons,
Yeah.
which you have to test with a nasal swab. And then
And it's
we have the
uncomfortable to do the test.
yeah. And then the mouth and the gums are so important for, hygiene there. There's so much rich data on, how that can trigger a lot of cardiovascular disease and degenerative neurologic disease. And then of course there's the colon. So I think simplifying things a little bit for people to like have their inflammation a bit controlled is to have some sort of a protocol where we're on a daily basis, nourishing these doorways and making sure that they're not harboring a lot of infections. So that's going to minimize the inflammation. And then things that can help boost our mitochondria are, well, I mean, sleep, right? So not much is more important than having good quality sleep.
Right.
Exercise, sun, really paying attention to that circadian rhythm.
Right.
Um, Supplement wise, NAD is a kind of a sister molecule to niacin,
Mhm.
and there's really good research on extending life and improving mitochondrial health and how that really becomes diminished the amount of NAD in our system as we get older or if we're in chronic stress states.
Mhm.
And there's different ways that we can get NAD into our system, but you can't take it orally. Some of the precursors to, so it's kind of those two ways. You can take NAD by itself, or you can take precursors that do absorb a little bit better orally. But we found that, a suppository delivery has been hugely helpful for people and then that means you don't have to go and sit and do a 5-hour IV.
Yeah.
We've created a suppository called NAD Max, and it's got close to 1,000 milligrams of both NAD and the precursors. And we'll usually recommend people do that in the beginning, maybe 3 to 5 days a week. You don't want to dose NAD daily. A lot of things are good to pulse. I think one of the exceptions to that would be melatonin. I think that's fine to take on a daily basis for years and years. And we propose doing the higher doses, like 100 to 200 milligrams of
Is that suppository?
So we have a suppository. We have a time release bar. It's like a little square. And
Okay.
then we also have a liposomal version of Sandman.
Okay. Awesome. Yeah. So you mentioned the Marcons. I remember a colleague in 2009 gave me a copy of Richie Shoemaker's book. And that's when I first learned about Marcons. And then I worked in a clinic in North Carolina with a nurse practitioner, and we would do that test, where you swab the nasal cavities or nasal passages. And people didn't like it, but when we treated it, they felt so much better. So along the same lines, a lot of times photobiomodulation, I have a transcranial photobiomodulation device somewhere here, but I also have the intranasal laser. And a lot of people will say, well, that's not getting to the brain. It's just increasing nitric oxide. But can you touch on how basically we can impact the brain by having things in the nose?
Yeah, well, the nasal passage is a direct route to the brain, and so it's a great way to make the brain unhealthy if you have poor hygiene in the nasal passage, but also there can be a nice route of administration to different medicines through the nasal passage. I think that we also have an NAD nasal spray that's quite popular, NAD Max. So yeah, not everything, when you start looking at intranasal medicine, it's not going to be the same quantity because you can't get a lot of milligrams of medicine in the nasal passage. But because it has such a direct route to the brain, you can get a nice brain effect, right? So if an individual, like say, if it's like NAD, was looking for like a full body absorption, the suppository is just far, far better. I would even argue it's better than an IV because
Really?
it's so slowly released over hours, and an individual can do it by themselves, several times a week for months, where, these IVs can be $500 to $1,000.
Right. Absolutely. And with methylene blue, I was talking with Lauren and Renee from the Biohacker Babes, and we were talking about, your take on, I think they said methylene blue, you say it has to be taken orally. Is that correct?
Well, methylene blue can be administered through an IV,
Yeah.
and it can also be administered through a suppository. We have a suppository as well, and then intranasally methylene blue, it's kind of so-so. But we don't want to do it in a sublingual because, again, there's not really a lot of dosage, and a lot of people don't want their mouth and staining their
Blue.
teeth, etc. But it does really well with a combination with stomach acid. So if you can get the methylene blue into the stomach, it absorbs really, really well. And then there's not a lot left over that can go into the intestines, which can be a little irritating to
Right.
people's intestines. And then you also, although we have a suppository, we really only recommend that for very short-term use because there can be a negative impact on the microbiome.
Gotcha. Yeah, I was going to ask you that.
Bring me an intranasal laser. Yeah. I want to show you this new, so the Violite, is that the one you're using?
So I have one. It died on me. Dr. Jack Carew is a colleague of mine, a neurosurgeon. He sent me one several years ago, and it just kind of died on me. But I had good results with it. It's the 810 nanometer one. But some people will say, "Oh, well, it has anti-pathogen properties, and that's why you feel better." I'm like, at the end of the day, I don't really care about the mechanism. I just know it makes my cranium better. At any rate, and then I have the Titan IR. Got it right here. So this is,
Yeah, for the frontal lobe.
yeah, exactly. And then that's 10 hertz pulsed alpha. Those are the two transcranial, well, one's intranasal and that's transcranial that I've used. But ATP production, and if I remember correctly, the brain has 9 to 10% the body's mitochondria, but it consumes 20 to 22% of the oxygen we take
Yeah.
in. So one of my mentors, he calls them mitochondrial buckets. And like you said, you noticed it first in the central nervous system, then perhaps in the heart or liver, because they're so mitochondrially dense. And I think, just speculating, that's probably one of the reasons why CoQ10, testosterone, if it's needed, can help to improve and increase cardiac output.
Mm-hmm. Yeah, for sure. Well, these rate limiting substances in the Krebs cycle, that is how the mitochondria make energy, are really important to look at. Things like CoQ10 and again, NAD is another one of
Right.
those substrates that are necessary to kind of keep those electrons moving through that chain. Yeah.
Right.
The Violite is 10 millivolts, right? So light is measured by the I'm going to show you this new device we have. You don't want to shine it in people's eyes. Yeah, you just shined it in my eyes. So it 10, and basically what it is it's a small electronic LED, right?
Mm.
And so this is what's on this other device as well. And these LEDs, they don't put out a lot of very penetrating light. And they can be quite beneficial. And we have a number of things that we use that are, red light panels and so forth. So we're going to be launching this this device here is an intranasal.
Nice.
It's actually laser.
Okay.
And this is 100 millivolts, 100. So it's 10
Wow.
times stronger, and it's actual laser.
Yeah. Versus the LED.
The laser, that
Oh,
means it's laser. So it's actually a very concentrated light source. And so basically this goes around like this. And you can see how bright that is. And the reason that we want to do this is because when light goes in the nasal passage, the skin is really, really thin. And so the light can go through that skin and directly radiate the blood. So it's basically giving the blood a bath, like a light bath, right?
yeah.
And so these are coming from Germany, and they're not they're so strong that they're not something that you could find commercially. They're more like for physicians. But
Right.
we have a membership club with mitozen.club, right? And a lot of our products that we have, some of the sprays and so forth, are only available to members. And so these devices we're going to be having up on the website within the next week or so, available for members of the PMA. So if it's something, I just, this has been such a game changer, and I agree with you. Like even the Violite, like you can feel the difference.
Right.
But let me tell you, Tim, you should try this. This is next
Yeah, I mean, I
level.
can see your nose illuminated on the outside, and I never saw that with the Violite or V-Light, at least
Yeah,
not with myself.
yeah, yeah.
And so, on average, how much will that intranasal laser run?
About 2,500. So it's considerably more. We also have another device that's for the ears, because we've been doing a lot of um, treatments and really paying attention to like ways that we can regenerate the inner ear. I was able to bring a technology about 12 years ago from Germany called LumaMed, and this is a series of laser treatments to the inner ear. And we've kind of advanced that. A couple of years ago, we started doing direct stem cell injections into the inner ear, and we're combining that stem cell injection with the laser treatment. And so these devices are something that we can send people home with, that they can do the treatment them. And then taking methylene blue along with these light treatments really makes a big difference, because the blue gets into the mitochondria, and the blue is absorbing red and it's reflecting blue, right? So you're absorbing all of those red photons directly into the mitochondria, which then can act as because your body, the cells can use both a photon and an electron to make energy. And
Right.
that's why we can utilize light, just like we can utilize electrons very powerfully.
Yeah, and that's why when I'm telling patients and clients, like, you need to get morning sunlight. Oh, well, I take a vitamin D supplement. I'm like, no, you get a lot more from the sun than just vitamin D. I mean, those photons really drive the mitochondria, got the cortisol awakening response, all those different, well, what traditional medicine would call side effects, but just effects, really. No such thing as side effects. But the light, like you said, is so powerful. And then while I'm getting morning sun, I'll typically walk barefoot outside. So I'm getting the anti-inflammatory effects systemically by adding the electrons and then the photons, helping to kind of stimulate my brain into producing more dopamine and driving the mitochondria. And I feel, kind of juiced up. And I'm sure you've seen the microscopy slides where they show how thick the blood is, and then they have someone ground for 20 minutes and they retest it. And it's considerably less viscous. So one thing I wanted to touch on, we talked about briefly, but stealth pathogens, let's say like Bartonella. So I know methylene blue has an impact on Bartonella. Do you use IV methylene blue for its antimicrobial properties, or its energy producing properties, or both?
Well, so primarily we're using it for chronic infection, and we're doing it in combination with intravenous silver, because silver acts as a photo dynamic, so it enhances its that whole ability, and it's also antimicrobial in of itself. And then we do the methylene blue intravenously, and then we have a laser that actually goes into the blood vessel and directly kind of bathes the blood. Then we'll have people do the intranasal laser as well. So that whole program is really important to have the maximal effect, to not only charge our mitochondria in our blood, but also to clear infections. Now, we do a lot of stem cell therapy in our clinic. We have probably one of the original clinics to start utilizing things like bone marrow and adipose tissue and different placental based. And we're currently using this new cell line called X cells, which we're just beyond excited about. It's these very hardy stem cells that have a survivability for weeks, and they just sit in there and excrete billions of exosomes. Um, but we like to do the methylene blue on the same day that we may administer some of these cells, because you're really charging up those stem cells with the power to do their work. And so I think, there's utilization for these protocols for boosting energy for different treatments that you might be doing. Just about everybody, I think, can benefit from like lowering, things like Epstein-Barr. I mean, we're all carrying something, and it's a constant battle. So charging up the immune system never hurts.
Yeah, I mean, I tell people all the time, they're like, well, I don't have a fever, I don't have a cough. I'm like, well, that's the acute phase, but do you have anxiety or depression or fatigue or joint pain? I mean, I remember being in my doctorate program learning, people with bilateral knee pain, a significant portion of them have mycoplasma antigen antibody complexes. And I think that's one reason why ozone injected into the joint prolozone works so well. But
We've started using injections of methylene blue and ozone into areas like that. And one of the things that I think we don't want to forget to talk about is the prostate for men, because that's another area that harbors a lot of infection. And I would almost argue that just about most every man after the age of 40, it's not a matter of, if they have an infection, it's how many different microbes. And you can do a simple test with a semen test. In fact, if you go to our website, we have a kit where it's a semen test along with a consultation. And anybody that's dealing with any type of, waking up a lot, urinating, what happens is we get the infection in the prostate, and then if that's causing that inflammation for a long enough period of time, it shuts down our energy production in there, and that's what breeds cancer, because cancer is going to be the end stage of chronic stress and inflammation. And so ultimately the infection is what's causing the swelling and the hypertrophy, and that goes on long enough, then it switches into cancer. So for us to be able to really isolate what microbes are in there, we can then tailor a specific cocktail of antibiotics along with methylene blue, which is extremely antimicrobial, and ozone. So we're doing all of those things, and we're injecting the prostate under ultrasound with guidance. We're doing a series of 3 of these injections, and we're also using a sound wave device into that area as well, and combining those 2 together, and very excited about the results.
Yeah. It sounds like, all the stuff you're doing is really cutting edge. One thing I just remembered to touch on is, I know there's some controversy with Nathan Bryan, the guy who wrote the book of nitric oxide, saying that methylene blue blocks nitric oxide. He uses it in his lab to block nitric oxide. And then apparently Chris Masterjohn wrote a Substack on it, and I haven't had a chance to read it yet. But I wanted to get your take. Does it interfere with the nitric oxide, INOS, ENOS, NNOS?
Oh, I'm so glad you asked that question, because this really needs to be cleared up. There's 3 forms of nitric oxide. There's inducible nitric oxide, there's endothelial nitric oxide, and there's neuronal nitric oxide. Now, red light therapy, one of the reasons it works really well is it increases nitric oxide, right? But it doesn't increase all the nitric oxide. So inducible nitric oxide, you could say, it's good and it's bad, but if we activate and we have too much of this inducible nitric oxide, it's inflammatory. So if we have an infection, we want to release inducible nitric oxide because it's going to vasodilate. It's going to bring more blood flow into an area so that the immune system can get in and do its job for an infection. And so the primary role of inducible nitric oxide is fighting an infection, right? Methylene blue calms that down, right? And in fact, methylene blue is positive for both inducible and endothelial neuronal nitric oxide. And it's primarily working against the one that you don't want. So if an individual is looking for a full erection and they're like, they want to have that pump and they want to go work out, that is not affected in a negative aspect. So it's another, it's kind of like looking a little bit deeper and not just making things a black or white.
Right.
So yeah, and one really interesting fact too is that the inducible nitric oxide is one of the primary causes of depression. So many people that are walking around chronically depressed, they have a chronic infection, right? And, Epstein-Barr, cytomegalovirus, mold, gut dysbiosis, nasal, infections, all of these things, candida. So all these things can kind of cause that inducible nitric oxide to be high and stay high. And the dangers behind that is that when it mixes with substances in your blood, it turns into peroxynitrates. And that's the most dangerous substance to your cardiovascular system. So we really, we want to think twice too, but taking a lot of these nitric oxide boosting supplements, especially on a chronic basis, because a lot of them are going to elevate that inducible nitric oxide, which is more dangerous.
Absolutely. I'm glad you cleared that up because I think people forget that there's not just nitric oxide on or off, that, there's three different types. And, some are the two that you mentioned, the NNOS and the ENOS are typically good. The INOS is good at clearing infections, but we don't want to, raise it too much. So in terms of ozone, I know we discussed that somewhat, but are you doing the EBU IVs in your clinic as well?
We are. Yeah, we have a couple of different protocols. One is called Rejuvenox, and Rejuvenox is utilizing a Russian method where we hyperozonate saline and then do a slow drip. And then we have 10-pass system, which is a German mechanism that's very, very powerful at ozonating the blood. And then EBU is where you're filtering the blood, and the filter allows you to bubble ozone into the blood so that it gets the blood very, very ozonated. And then as that comes back into the body, we run it through light and we add a little bit of methylene blue to it.
Well, awesome. What's something that you know today that you wish you would have known 10 to 12 years ago?
Well, everything we're talking about. I mean, I wish I knew about methylene blue for sure. I wish I knew about melatonin. I struggled my life, I think, you know, I I don't know, this is something that I have talked about before, but you're seeing a lot of the attorneys that are advertising about Camp Lejeune and the toxicity. And so I was a victim of that. I was actually in utero with my mother, and my first 2 years of life was on that base. And my father has cancer. My sister has a lot of health issues. My mom, crippling arthritis. And so I found myself in learning disability classes, and had a very tough time growing up with just a lot of allergies and asthma and energy levels, and so it's been a tough healing journey for me up to this point, and I think I'm lucky to be here, really, and to be as healthy as I am. I would consider myself above average health wise at 50. I'm about to turn 54, and I don't think I could have made it this far if I didn't have all the tools in place to keep my body detoxed, keep my
Right.
mitochondria charged. And all of these things would have been really nice, back in those days where I was really suffering with, a lot of disease.
Yeah, I remember on one of your Instagram reels, you said, I think you had to close your practice down for like 5 or 6 months.
Yeah, yeah. I got so sick, I had to just close it down.
And now I know you have yourself, but you have nurse practitioners on staff doing the fluoroscopy or stem cell injections. Is that correct?
Yeah, we have a cardiologist, we have a podiatrist, we've got two PAs, we've got a nurse. Yeah, wonderful. I'm just so lucky to have such an amazing staff. They're very caring. Patients that come to the clinic are always commenting about how warm and helpful our staff is.
That's awesome. And I don't know if you're accepting new patients, but if so, where can they find you?
So I do a lot on Instagram at Dr. John Lieurance, and our clinic website is advancedrejuvenation.us.
Okay.
And then Mitozen, where I am the scientific advisor for a lot of different products, the unique kind of delivery systems, and that's mitozen.club.
Okay. Awesome. Well, thank you so much for the work that you're doing. I know your patients appreciate you. Thanks for all the knowledge and wisdom you're sharing on Instagram. Like, obviously, you have other things you could be doing that would be much more profitable, but I think giving back seems like it's important to you, and helping people a few steps behind you. So keep up the great work, and hopefully we can have you back on next year for some more cutting edge updates.
Sounds good, Tim. Thank you for having me.
All right. Have a blessed day.